Hello, Ronnie Angel here of Next Level Fitness and Healing. We help our clients get out of pain and help them live healthy, active lifestyles through nutrition, lifestyle, and fitness coaching. What I want to share with you today is a lot of clients sometimes come in with some knee pain, maybe due to a hard leg workout or walking mountain, climbing hills or hiking or cycling. And it creates a little bit of tightness in that quadricep is what I find most of the time is contributing to some of that knee pain. So I want to show a few things here that you can try to see if that may help alleviate some of that pain. I like to use a foam roller starting off with. What I do is the side that's causing the pain or the knee that feels in pain, you want to have that on the roller. What I do here is I have the opposite leg out to the side, so that's kind of bracing me here and my elbow here. So that's where I'm at right here. I'll show you a couple different angles so you can take a look at it. So the quad, it's hurting the knees on the foam roller. The other leg's off to the side. All right, so we're on the foam roller. So what I want to do here is I just want to roll back and forth. I want to make sure I stay off of the knee so I can come right up to the top of the knee and then all the way up into that hip crease. And notice I've got any tenderness through there. I can roll my foot up, so I'm working more the inner part of the thigh. You can work that area. Then you can roll over, work on the outer part of the thigh. Work in that area. So roll those back and forth about a minute in each spot, or if you find a spot that's tender, stay in that area a little bit longer. And then, for some reason, of course, check your other side. See if you notice a difference between the two sides to see. Majority of the time, the quad or that upper leg thigh area that the knee pain is on is going to be more tender or sore than it is on the opposite side. For some reason, if you're not able to get in the floor with the foam roller, massage tool, massage roller, they work out really well as well too. You want to keep this leg relaxed as possible, the leg that you're feeling the knee pain in. And then you're rolling this back and forth, up and down the quad, even on the side, even in the middle. And if you feel any areas that's tender, like if you got knee pain on the inner part of the thigh or inner part of the knee, most likely those adductors are the ones that are a little bit tighter on you. You want to kind of roll those out. Also, center part of the leg or the top of the knee or right below the knee, maybe more quad dominant tightness in that area, or even here on the side down on the lateral part of the leg, could be the IT band, which is all the way up in here. You want to roll all the way up in here in the teres fasciolae, that little spot up here that's usually contributing to some of that. So you want to roll all that out. So there's a couple things you can do massage tool. Well, that's just to help break things up and get it going. The next would be a stretch. So you can also use this bench to really get a good deep stretch. So I'm at like a 90-degree angle here, and my leg is here, and my foot is on the bench here. I'm upright, and I'm rotating my pelvis. So I'm posteriorly tilting my pelvis like I'm trying to pull water out of the back side where my butt's at. So I'm trying to tilt that. That should increase the tension through here. You should feel that stretch through here in the rectus femoris and also the whole hip flexor complex, your iliopsoas. So you're feeling that area there. So there's a good stretch that you can do. For some reason you can't get on the floor, you can use something to hang on to and then just do a basic quadricep stretch. So you're here to the side. What you want to do is up tall, so you're really nice and tall, pulling up behind you, pulling the knee or your heel to your butt, keeping your knee pointed down, and also to the other knee. So you want to keep it up here. So that way you don't want it to flare out. You want to keep it down next to the side and pulling that up through there. You should be getting a really nice stretch all through that quad region. If you felt that through the knee pain towards the inside, you may want to do like a side lunge stretch coming to the side, working a stretch down through that area also. So try those foam rolling and stretching techniques. Those should help out alleviate that knee pain. If it gets a little bit better after you got done doing that, you know you need to be able to put that into your program of doing these foam rolling or self-massage and stretching techniques to be able to help alleviate that pain. If that doesn't get better with that, With those stretches, if you don't feel any difference at all, you may want to go get it checked out by a physician or something like that. But those are some you can try before you want to go to that next step. I hope those were helpful, and I'll see you here soon with something else coming up, most likely working with some back pain. Thanks again.